Hi and welcome to this week's episode of Talking Fertility on Facebook Live, where I'll be coming to you every Monday morning at 11 a.m. talking all things fertility. And this week I'm going to be talking about one of the most commonly diagnosed hormonal conditions which is affecting female reproduction. And that's polycystic ovarian syndrome, or PCOS, as many people would know it. And one of the reasons why it is so commonly diagnosed is because the symptom picture for PCOS is really so broad and quite varied. The symptoms can include premenstrual syndrome, premenstrual tension. You can get erratic ovulation, so sporadic ovulation, or anovulation, so no ovulation at all. You can get irregular or infrequent, sometimes heavy periods, so quite a variety in the period dysregulation there. There is subfertility, is a common theme, and difficulty falling pregnant, which is largely due, which is largely due to that sporadic ovulation or that inability to properly ovulate can cause those fertility issues. Multiple cysts on the ovaries, difficulty losing weight is a common theme. Also some mental issues, depression and anxiety, mood swings. Acne is quite common, or darkened patches of skin. There can be issues with hair, either hair loss or actually increased facial and body hair due to the hormonal disturbance which really underlies polycystic ovarian syndrome. And there actually has been much debate, particularly recently, about whether the name should be changed from polycystic ovarian syndrome, because in actual fact, a lot of sufferers of PCOS don't actually have any cysts on their ovaries. And that is actually not a diagnostic criteria. You don't have to have polycystic ovarians or cysts on your ovaries to be diagnosed with polycystic ovarian syndrome. So it is quite a broad classification. So in fact, research is suggesting that PCOS is potentially overdiagnosed because, as I mentioned, the symptom picture a lot of people can relate to, and they think that actually about 1 in 4 women experience some of the symptoms related to PCOS and may in fact being wrongly diagnosed with PCOS because it may be related to other symptoms and other syndromes, particularly other syndromes like metabolic syndrome, which is another issue which affects insulin resistance, which is a common theme in PCOS, inability to lose weight and particularly abdominal fat, high blood pressure and high cholesterol. So metabolic syndrome has a lot of overlapping factors of PCOS as well. But I guess on the flip side of the underdiagnosis, there is also overdiagnosis. There's also a lot of people that aren't being properly diagnosed, so underdiagnosed of PCOS, because many women actually aren't actually aware that they have PCOS until they go to fall pregnant, and further testing is done as to why they're not being able to conceive. And it's actually diagnosed then, which is unfortunate because that's actually quite late in the piece and it makes it difficult for pregnancy to occur, which is why there are more calls for more awareness of menstrual health earlier in life, which I am so passionate about, promoting awareness of our menstrual cycle and our fertility earlier in life so we don't get the shock when we do go to fall pregnant later in life. Because so many women and girls do experience some quite severe symptoms during their period. So cramping and pain. Well, no amount of cramping or pain is truly normal. Those symptoms need to be investigated, but often women do dismiss them as normal, as a part of just their regular menstrual period. And it's not until they go to fall pregnant that they realise there are underlying issues there. And those issues really need to get the cause of what is causing that hormonal disturbance, what is causing that issue, and they need to be properly treated. And I don't mean by going on the pill. And I see this happen all too frequently because women are struggling with their periods, or girls are struggling with their periods. They have heavy periods, perhaps heavy bleeding, pain, and they are put on the pill, which is a great way and very effective way to alleviate all those symptoms. So it alleviates the pain. It can reduce those heavy But unfortunately, it's not getting to the root cause of the problem. And I see a lot of women who have had this kind of treatment then coming to me when they want to fall pregnant, because what happens is, obviously, to be able to fall pregnant, they need to come off the pill. Having been on the pill for quite some time, unfortunately, the symptoms are still there. The problem is still there. The pill hasn't taken away the problem, it's masked the symptoms. So we really need to get to the underlying cause of the problem rather than just masking the symptoms, and the pill takes control of our own hormone system. So the underlying issues are still there. So personally, I generally do investigative tests and organise appropriate herbal and nutritional supplementation to support that underlying hormonal issue, which is affecting the ability to ovulate, and help women to rectify the hormonal issues, rectify ovulation and improve ovulation to improve your chances of conceiving and carrying your healthy baby, which is what we all want. Because sufferers of PCOS do commonly have difficulty falling pregnant. And it is largely due to those hormonal issues which are affecting ovulation and their ability to ovulate. As I mentioned earlier, that either sporadic ovulation, so it may happen one month, it may not happen the other month, or some women with PCOS don't ovulate at all. So it's that annual ovulation or that sporadic ovulation that we really need to fix in able to enable PCOS sufferers to fall pregnant. Because, true PCOS sufferers actually have high ovarian reserve. This means they actually have a high volume of eggs available in their ovaries, which is a positive marker for fertility. It is just a matter of actually getting those eggs out of the ovaries, so improving that ovulation and getting the eggs out to be able to be fertilized, which can help with fertility issues. And this is why many women with PCOS are able to conceive with proper treatment of the hormonal issues, once you're affecting that inability to effectively ovulate. And that's why what I like to work on with women with PCOS is establishing better hormone balance and improving ovulation to improve your chances of conceiving and carrying a healthy baby, and working with your own hormonal system to get that functioning more effectively rather than taking over control with any other medication. Because still the exact cause of PCOS is largely unknown. Studies do show that there is a genetic component. It's commonly found in family members, so a possible genetic link there. And there's such a wide variety of symptoms, as I spoke about before, and some women will experience very few symptoms and almost be unaware that they have the hormonal issue associated with PCOS. Whilst other women really struggle greatly and the symptoms are quite severe and really impact their fertility, their reproductive health, and their general health and well-being each month as well. So the symptoms can be quite severe in some sufferers. And unfortunately, there is no cure as such for PCOS, and medical treatment options are fairly limited, and they often involve the pill, which is obviously not an option when you're looking at fertility and wanting to fall pregnant. So, but fortunately, there are many natural treatments, and there are a lot of diet and lifestyle modifications that you can make to improve your fertility and really boost your fertility with PCOS. So I do see a lot of women able to fall pregnant who do have PCOS. So today I'm going to be talking about some of the simple diet and lifestyle changes that you can make today to start boosting your fertility with PCOS. And one of the common symptoms of PCOS is blood sugar or unstable blood sugar levels. So I'll talk about the glycemic index diet, and eating for glycemic index is so important for PCOS, because eating a low glycemic or low GI diet naturally helps to stabilize those blood sugar levels that are naturally unstable and unregulated in PCOS. The lower GI, the food, I guess the slower it is to be metabolized and released into the system. So this reduces the load on insulin, which I spoke a lot about a couple of weeks back when I talked about weight loss and fertility. And obviously weight gain and difficulty losing weight is a common issue in PCOS. So I encourage you to check out that episode of Talking Fertility as well. That was fertility and weight loss. But yeah, eating low GI does really alleviate the load on insulin, because we need insulin to be released. When we have high refined sugar meal, we need insulin release to grab hold of that sugar and rebalance our blood sugar, because it's very important that our blood sugar remain relatively constant and stable all the time. So eating foods that don't have such a spike on that blood sugar and are slower to be released are much gentler on the system and actually keep you feeling fuller for longer. And there was actually a study in the Medical Journal of Metabolism concluded that low GI, lower carbohydrate, low GI and higher protein diet improves insulin resistance associated with PCOS and improves blood sugar balance. Whereas a high carbohydrate, low protein diet had the opposite effect. And now when I talk about higher protein, I'm not talking about that crazy, high protein, no carb diet. That's certainly not sustainable and not recommended in PCOS. But a balance of a low GI, slow carbohydrates, so whole foods and slow carbs, and high quality protein, as well as good fats, which again I touched on a few weeks back, and good fats are really important to lower the GI as well. And when I talk about GI, I know there is a list of glycemic index foods and related to their level and their number, but I don't like you to get hung up on a number or a score or, constantly checking what number the foods you're eating are. I don't think that's a sustainable method of diet control. And I don't like to be looking at packets either. What is low GI? What's written on the packet? In fact, I'd rather you throw the packets away. Because when it comes to low GI, the best thing to do, of course, there are those lists, and you can Google those lists if you really want to look up each of the numbers of the different foods. But the most important thing is to look at the principle of low GI and what it means. And basically what it means is low GI foods in general will have a fiber component to them. They'll have a whole food component to them, and they may have some fat or protein associated with it as well. And you can actually lower the GI of some foods by having, for say, you have your high GI fruits, which are some of your high sugar fruits, incorporating some nuts with those fruits lowers the glycemic index, because that fat from the nut and the protein helps to slow the release of that natural sugar. And again, I talk about it a lot, but it really comes back to whole foods. And eating foods in their natural whole state, they naturally do have the fiber with them. They naturally contain the whole grain component. They often do naturally have some component of fat or protein within them. So eating whole foods, avoiding highly processed foods, and particularly refined sugars. And I guess I'll touch on sugar a little bit more, because sugar is really something that you want to avoid, and particularly that refined sugar associated with processed foods, because sugar fuels inflammation, and inflammation negates fertility. So you really want to reduce inflammation in the body as much as possible. That goes whether you have endometriosis or PCOS or any condition affecting fertility, really, is to reduce the inflammatory process. And sugar also obviously spikes that insulin result. So it actually exacerbates insulin resistance and can even cause insulin resistance in someone with a high sugar diet, which contributes to the weight gain as well, which is also an issue in PCOS as well. And even just losing up to 5% of body fat can have a huge impact on PCOS. And the lower that we can get to that healthy weight range, that 20 to 24 BMI, the better. But even slow progress can make all the difference. So even just a 5% reduction in weight, and that can be easily done using the low GI foods, can have a great impact on that hormonal balance and that ovulation as well. So again, as I spoke about in the previous episode of Talking Fertility, where I spoke about weight loss, insulin resistance associated with weight gain disturbs the hypothalamic pituitary ovarian axis, which is basically the feedback loop which regulates hormone production within the reproductive system. So we really want that feedback loop working effectively, and a high refined sugar diet can interfere with that because of the insulin resistance. And this hormonal disturbance, when that feedback loop is disturbed, it affects the menstrual cycle and can disrupt our ability to create an egg or stop ovulation altogether, which is already obviously an issue in PCOS, is that anovulation or lack of ovulation. So we really want to get that axis and that feedback loop working effectively. So reducing your intake of sugars, particularly those refined sugars in processed foods, is super important when you're talking about PCOS. And I touched on fats just before, but I will talk a little bit more deeper on fats because it is really important, as I spoke about in Weight Loss for Fertility. Not all fats are bad fats. And in fact, as they sound, some of them are actually essential fatty acids. They are essential to incorporate in your diet. So including healthy mono and polyunsaturated fats into your diet, and even small healthy amounts of saturated fats like coconut oil. Is a great way to lower the GI of foods and balance out that blood sugar. Now, obviously, we still want to keep saturated fats to a minimum. For example, a daily intake of saturated fats would be 1 serve of red meat would provide all the saturated fats you would need. However, complete avoidance of saturated fats is not necessary. And actually, having some of those saturated fats, particularly the healthier options like your vegetable oils, your coconut oil is your vegetable source of a saturated fat, can really lower the GI of foods. And what that does is it helps to stabilize your blood sugar, which is great for that insulin resistance. It also helps you feel fuller for longer. So complete avoidance of saturated fats is not necessary. The only one you want to completely avoid is the trans fats. And I go into a lot more detail about the different types of fats and what to avoid and how much to include in my course, Your Fertile Pantry, which I'll be releasing very soon, and details of which are coming up on TashaJennings.com.au. So make sure you keep your eye out for that one, where I will go into more detail on these sort of fats. But essential fatty acids in general, essential fatty acids are the ones you want to focus on. They really are health promoting as well as helping to stabilize blood sugar. So they also have the added benefit of supporting cellular health, because essential fatty acids are involved in the cell walls of every single one of our cells. So they help support each cellular health, and they also help to reduce that inflammation, which I spoke about earlier. So essential fatty acids can be found in foods like nuts, seeds, avocado, fish, olives, flax seeds and olive oil. So particularly the omega-3 is the one you want to be looking for. We generally have an excess of omega-6 in our diet already, and we really want to be getting more of that omega-3 essential fatty acid into our diet. So I guess going back to whole foods, the other thing you want to look at in relation to whole foods, and again, it's another topic I talk about a lot, is organic versus non-organic. And when it comes to the pesticide load of foods and wanting to fall pregnant, organic food is the best way to go. Organic food is grown without the use of pesticides and herbicides and other toxins. And these toxins have been shown to negatively affect hormonal balance, increase inflammation, and overload our detoxification pathways. And in fact, consuming high levels of fruits and vegetables containing these pesticides is linked to subfertility and infertility in both females and in males as well. So eat organic as much as possible to reduce the toxic load on an already overloaded hormonal system. If you do have PCOS, there already is that load there on the system. So and especially look for free-range and organic meats where possible, and avoid artificial hormones wherever possible. If you can't buy organic all the time, a little cheat I use, and you can refer to this, is the Clean 15 and the Dirty Dozen. And basically, this is the list of the least pesticide-loaded foods and the most pesticide-loaded food. And you can find that. I'm pretty sure I popped that on their website and also on the Facebook page. And I'll put a link to that as well under this post if you don't have a copy of the Clean 15 or the Dirty Dozen. But basically, if you think of the general principle of the more porous the food, the greater the pesticide, more pesticides it will absorb. So, for example, strawberries are going to have a much higher pesticide load than something like watermelon, which has a really tough outer shell. Because unfortunately, when it comes to pesticides, it's not just a matter of washing them off. We can't just scrub off the pesticides off the outside of our fruits and vegetables, because these fruits and vegetables have been grown throughout their life cycle with a steady stream of these toxins throughout the growth cycle. And particularly those porous fruits and vegetables. And I spoke about this in another episode about male fertility when I mentioned that, because that's particularly impacted in male fertility, the pesticide load. And I saw a little demonstration. It actually was nothing to do with fertility. It was actually on Play School. But they had little cups, and the little cups were filled with food colorings, or blue, or purple, or red, I think they were. And they had a celery stick. And they pop the celery stick in the food colouring, and you can just watch as it really sucks up all that food colouring right the way through the celery stick, and it becomes blue or purple or red. And that's the same thing when we put our porous fruits and vegetables are grown within these pesticides. They really soak up and absorb them. So unfortunately, it's not a matter of just washing them off. So look for organic wherever you possibly can, and also go for the clean 15 and the dirty dozen if you can't get organic all of the time. So the other thing in relation to weight loss and stable blood sugar regulation is small regular meals can be of great benefit with women with PCOS. So they further support healthy blood sugar levels. 5 small meals during the day rather than those 3 large meals, because this helps to stabilize blood sugar throughout the day. It helps reduce cravings and helps to support that healthy weight balance as well. So ideally, when you're looking at the components of all these 5 snacks and meals during the day, you would be wanting to have meals and snacks focusing on incorporating those whole foods and those whole grains, those slow release, low GI carbs, organic fruits and vegetables where possible, a healthy protein source, as well as potentially some good oils as well. So an example of a great healthy meal would be a salad with some olives in there, a splash of good olive oil, some great organic salad leaves in there as well. So you've got a good balance, perhaps even some grains in there, a good balance of some fiber, some fat, and some slow release carbohydrates, that if you do have some natural sugars in there, that the release will be slowed into the system, so you don't have that drain on insulin. So if you want more information on weight loss particularly, jump back to a previous episode, because I know weight can have a significant impact on that ovulatory cycle in PCOS. So I hope that's given you some insight into PCOS, what it is, how it does affect fertility, as well as some dietary guidelines that you can start using today to help boost your fertility with PCOS. And again, jump over to tashajettings.com.au. I will be going into more detail on a lot of these dietary factors in the Your Fertile Pantry course, which I'm so excited to be releasing very soon. So stay tuned for that. I'll be popping details on the Facebook page as well. So for more information or to have your say on next week's topic of Talking Fertility as well, be sure to jump over to the Facebook group, the Conceive Baby with Tasha Jennings Facebook group, and join the discussion in there where you can have your say on what is affecting you and what you want to know more about. And also jump over to conceivebaby.com.au and join our newsletter for the latest information from leading fertility experts from across the globe, as well as our fabulous webinars and podcasts. So thanks for joining me this week, and I look forward to seeing you next time.